Hi, welcome to another episode of the Good Neighbor Podcast, coming to you live from the Ignite Creative Studios in Ridgewood, New Jersey. I am your host, Doug Drohan. I'm also the owner of the Bergen Neighbors Media Group. Today, we are thrilled to be joined with Dr. Peter Marta, officially known as Dr. Pete.
Dr. Pete, yep.
He's a highly respected board-certified physician and surgeon. He's worked in a number of hospitals throughout Bergen County. He's renowned for his minimally invasive technique and comprehensive approach to men's hormones and health in Bergen County, which we're going to dig into.
Oh, yes. Yeah.
You're the founder and owner of Codex, which you see the logo behind me here. It's a men's health and hormone optimization practice. So, Dr. Marta, welcome so much. Welcome to the
Thank
show.
you. The hardest thing for me is education for the men. So being able to do something like this is so huge.
Yeah. So
getting the word out.
Men of a certain age, but I think it's men of any age, right? I just had someone on the show who was in his 30s who says, I never go to the doctor, unless I just need a physical or I'm about to die. Otherwise, they never go.
And that's really it. My patients are mostly from 35 to 70, 80. And I kind of did a video a short time ago saying, why do guys go to the doctor? And there's 3 reasons. In pain that's leading to death, or erectile dysfunction. Those are 3 things to get guys to the doctor.
Wow.
That's it.
Wow.
And from doing medicine for going on 25 years now, you really get to know the patients well. You're having lots of intimate conversations with them. You're talking about end-of-life issues, you name it. And it gives you a real snapshot of what people want in their healthcare.
Right.
And I've learned from that over the last years.
So I was having a conversation with my wife last night, saying, hey, I'm going to interview you today, meet you today. And she found it interesting that there's actually a medical practice directed just towards men with hormone optimization. We won't call it hormone replacement, right? And I said, I think, there's been a sea change in how people approach aging, right? Where we used to just all, talk about my parents' generation, even not even that far back, where it's just a natural process. I'm getting slower. I'm getting tired. I just accept it. This is what life is all about. Yeah. But, when they say things like, 50 is the new 30 or 60 is the new 40.
Kind of is.
It is. And there's a reason for that. And it's, people are more active. And you want to stay healthier at a longer point in your life. And being a man of a certain age, I've got a 12-year-old son. Mm-hmm. So I'm still coaching sports. I'm doing all these different things.
Yeah.
I don't want to slow down. Why should I accept it? Right. And I could do the natural things of working out, but even that's harder because I've got arthritis or I've got this or I've got that. So how do you come in? Like, where do you come into this equation of somebody who doesn't want to accept the fact that I'm going to have a dad bod and I'm going to eat Cheetos and watch football every Sunday?
A lot of it, when I first started out doing this particular part of medicine, I was looking for what was the motivation that guys looked at. What did they want out of life? And I realized I had it all wrong. It wasn't just about going to the gym, being strong. One of my patients came in and he goes, I saw this advertisement, and it was an Italian advertisement, and it was an older man, probably in his 70s or 80s. And there was no speaking in the advertisement, but all it shows is this older man going into a gym, lifting kettlebells over his head forward. And people looking at him going, why is this guy doing this exercise? He's 80 years old. And time would go on, and you would see maybe 3 weeks later, he's wearing a tracksuit, and he's back, and he has more weight, and he's doing it. And people are kind of giving him a look, thinking, what's this guy up to? So at the end of the commercial, you see this man walk into his family's house and picks up his granddaughter and throws her up. I was like, wow. Yeah. And this guy looks at me and goes, Doc, that's why I'm here. And I stopped, and I was like, that's profound. And then as you talk to people, it all comes back to that. It comes back to, I want to age well and still do the things I want to do when I'm older. Yeah. I want to pick up my grandkids. I want to go golfing with my friends. I want to have quality of life. But it all came back to family for all these guys. And that's the common denominator. It's not what you would think it is. It's family, it's legacy. And guys want the health to be able to do those things. And it hit me hard. And I was like, man, that's emotional, number one. When you see that, you're like, what an amazing commercial. I mean, who came up with that was a genius.
Right.
But that's the insight. And that's really summed everything up to what I was doing with the practice. And coming to this point, I've been in medicine for 25 years now. And as a surgeon covering ERs, I'm dealing with people who are extremely sick. So I'm covering critical care, taking people to surgery that night, seeing them in the ICU. Some of my patients were young. Some of my patients were in their 90s. And no matter what you did in surgery, even if the surgery was a success and say it was a perforated colon or a perforated stomach, you had someone in their 90s who didn't really have the functional capacity to heal from what you just did to save their life, and they didn't make it out of the hospital. And I would have these conversations with these men mostly, who were literally realized they were going to pass away in the next 12 hours, and still lucid enough to talk about it. And I was so privileged to be able to sit there and have these conversations with you, because they would look back to their life. And one guy said to me, "I'm satisfied. I did everything I wanted to do in my life. I was driving my car till last week. I was going to see my sons. I had grandchildren. I have great-grandchildren. What else could a man ask for?" And I walked away going, whoa, he knows he's going to die in 8 hours, 12 hours. And that's the conversation. And I walk away going, that's amazing. And the next day I came back to see him, and he passed during the night.
Wow.
And I'm thinking, to be able to have that kind of satisfaction at the end of life, to look back and say, I did everything I wanted to do. I was able to do those things.
Right.
That's where I want to get my patients, to that point. Because not everyone's there. And I would see just the opposite. Guys who had not taken care of themselves, who were in their 60s passing away. You don't want to see that, And so I was blown away by those gentlemen saying those things, and it drove me to really make this a very personalized experience for my patients. It's amazing.
So it's not an aesthetic thing. I mean, the Italian commercial is great. It wasn't about, I want to have big muscles. It's, I want to be able to lift my grandkid up.
That's what it comes down to. It comes down to being able to be functional, healthy. And it's funny that we're meeting today because yesterday in the news, if you watched the news or your wife was probably watching the news, the FDA dropped the black box warning on estrogen for women for hormone replacement therapy, which is huge. So for the last 30 years, in 2003, a study came out that was very flawed and scared the hell out of a generation of women. So this study came out and said, if you go on hormone replacement therapy, you're going to have heart issues, you're going to have cancers.
Right.
So of course, any patient sees that, they're not taking those drugs. They're not doing it. So you scared a whole generation of women. And then studies started coming out over the last 25 years refuting all of that and going just the opposite way. Reduces cardiovascular disease, reduces strokes, reduces breast cancer incidence by being on hormone therapy. So a group of doctors, probably 6 or 7, went to the FDA over the last couple of weeks and said, listen, we have all these papers. Everything you guys are saying in this black box warning, saying that if women go on hormone therapy, they're going to have cancer risk and heart attack risk, is just not true. It's just the opposite. So you have to reverse this. And after a big fight, the FDA backed down, and they took the black box warning off. And now that's getting out there. So women are being educated. Yes, go to your doctor, be treated. There's no reason to suffer through this. And you have quality of life and even longevity from the treatment, which is huge. So, here we are meeting and talking about men's health. Well, the men are about 5 years behind as far as the research goes. The papers are coming out. So what they're seeing now is they are seeing a reduction in heart attack risk. They're seeing a lower rate of prostate cancer in men on hormone therapy, which is amazing, that no one expected. The urologist didn't even expect this. But even osteoporosis happens in men too. When you're on testosterone therapy, that goes away. So the same health benefits are there for men as for women. But unfortunately, they're not talked about because testosterone is kind of villainized. Which is the big problem. Right.
So when you talk about hormones with men, what else are we talking about besides testosterone?
It's testosterone. So the great thing about men is men are much easier to manage than women are because you're dealing with estrogen, progesterone, and to some extent even testosterone in women as well. So a little more complex. Men are a little simpler in the respect that you replace testosterone. Testosterone is converted to estrogen in men's bodies to appropriate levels usually. And estrogen is very important in men as well. But the body makes it from testosterone that you give. And that's where you get all your benefit from. So estrogen in particular drives men's libidos, which you would never think. Reduces osteoporosis in men, which you would never think. Reduces heart attack risk in men as well. And then being on appropriate levels of testosterone as well reduces your risk for insulin resistance and metabolic syndrome. You actually lose weight on it. You build muscle back. It's a true longevity drug. So if you think about, I always tell people, think about your high school reunions. You go to your high school reunion, you're all in your 40s. Everybody looks pretty much the same. Now you go back in your 60s. Huge differences. What's the change? The hormone levels have dropped off in the men and the women. That's the change. And you don't think about it, it's just age. It's not just age. It's your body is physiologically and biochemically changed. And yes, it's natural aging, but it accelerates at that point. Because you're taking away a foundational hormone. So
now, do you just, but going back to what I said, years ago, people just accepted it.
They did.
So are we messing with nature by not accepting the
you would
fact
think
that this is a natural decrease of my T levels is natural and just let it go?
And I think that's where the fear comes from is that, when those studies were coming out about estrogen all those years ago, people were saying, even doctors were saying, listen, it's part of life. Just deal with it, deal with the symptoms, go through it. then you start realizing, wait a second, that's not really true. You know, we have the ability to prolong life. I think definitely improve the quality of life.
Right.
But it's done carefully, supervised to physiologic levels. And we're not talking about making Arnold Schwarzeneggers. You know, we're making functional men, because if your hormone levels work correctly, everything else falls into place. And I think there was some thinking, well, if we do this, we do that, it's going to cause problems. It hasn't panned out that way at all, which is interesting.
Yeah.
And thank God it hasn't, because if it's done right and responsibly with good follow-up, with the appropriate patient, you benefit. You really do.
So you mentioned Arnold Schwarzenegger. So to make a clear distinction, what are the age ranges that you deal with? Do you deal with young, like teenagers? Do you deal with people like maybe there's a teenager whose T levels are pretty low, and there's medical complications because of that?
Yes.
And then obviously it's not steroids, so they're not going to, they're not going to get bulky and right. So can you make that distinction? Like who do you, like the different age groups that you might treat, and what are the different, I guess, cases of why somebody young would see you versus somebody?
Yeah, sure.
Yeah.
So the first thing is think about steroids in the respective bodybuilders and performance-enhancing drugs like Barry Bonds and those type of things.
Right.
That's anabolic steroids. So that's taking the bioidentical testosterone, taking that molecule and then changing it in the lab to something that has anabolic effects. So the steroids that the bodybuilders are taking are synthesized testosterone with modifications. It's not bioidentical. So two different molecules entirely. So what we're using in medicine is HRT, hormone replacement therapy, which is bioidentical testosterone. So that's what we're giving to people where it's appropriate. And then that molecule is recognized by the body and it's metabolized correctly into the correct things like estrogen and other side molecules. Whereas the anabolics don't work that way. That's a whole different thing, and we don't do that because that has been shown to cause heart attack and things like that. That's not what we're doing. So as far as case studies, I see patients of all ages. The youngest gentleman I've seen was 25. With super low testosterone, erectile dysfunction at 25. And so in those patients, you approach them a little differently. You're looking at lifestyle. So you're asking about diet. You're asking about activity. You're asking about other medications they're taking, injuries, things like that. So in those men, you don't want to give testosterone right off the bat because it actually suppresses testicular function and actually it can mess with fertility. And some men recover, some men don't. So you can't go those routes. There's other medications you can give in those situations. But what we do with those people first is lifestyle modifications. So we say, okay, what's your diet like? Is it high in fat? Is it high in carbs? Are you eating tons of sugar? Are you overweight? All these things influence testosterone production. Are you sleeping well? That's massive. In someone who's young, especially someone in their teenage years, 20s, remember when we were in our 20s, you're sleeping 12 hours a day, right? I mean, that's just how you are. So if you're getting 5 hours of sleep a night, that's affecting your circadian rhythms and affecting testosterone production. So you try to fix those things first, and usually you can get the production up, get the levels back where they need to be. If you're still having issues, then it's a more extensive workup, and it's probably see an endocrinologist as well to see, okay, is there a tumor somewhere? Is there a pituitary dysfunction? Different approach. Men, when you get into the 40s, usually at that time you're seeing the natural decline in testosterone, and you can give testosterone to them because especially if they've had a full family, they're not having any more children, they could care less about fertility. Those are the ideal candidates for testosterone at that point. And most of my patients, I would say, are probably in their 40s and 50s is probably the average. And those gentlemen have had their families. They're going through the natural decline, which is essentially an andropause. I call it manopause. You're basically losing your hormones as a result of aging. And the problem with now is our diet is so bad in the U.S. and so high in sugar that obesity is becoming an issue, and the obesity is actually lowering our testosterone levels. So even those guys, I talk to them about diet too. I said, listen, let's bring your diet down first. Some guys aren't too hot on the idea of testosterone. I said, that's fine. Let's find other ways. And then if nothing else is working, or you have fixed your weight and you are working out and you still can't see any results, okay, let's go with testosterone.
Got it. So when did you start this, your practice? Like when did Codex?
So officially this opened, it's been about a year now. And I've been in this space in my other practice probably about 5 years. Because I've always been a workout guy. I've always been into, I'm a molecular biologist by training. Originally I have a master's in molecular biology from Rutgers. And I went to medical school afterwards. Where I fell into surgery over the years, but always had a love for...
Fell into surgery.
I guess that's a good way of putting it, but having that background made me appreciate the molecular side of things and how the body works.
Yeah.
And then being into fitness and seeing what you see in the gyms and seeing less and less older guys in the gyms. And mostly, even when you go in the gyms now, you see very few guys in their 70s or 80s in there.
Oh, yeah.
You know, the average age I would think really is 20s.
Yeah.
So my feeling is, where are the older guys?
Yeah.
Why aren't they still doing this?
Right.
And they need to be.
Yeah.
And even in my surgical practice over the last 5 years, I would see guys in. I'm like, "How's your diet?" And they would look at me, "Why ask me about diet? I'm here for a hernia." And I said, "Well, all of this plays in."
Yeah.
And they go, "Oh, okay." And they would kind of, and then I would have guys ask me about erectile dysfunction in the office. And I was like, thinking, "Well, why are you asking about that?" He goes, "Well, you're checking my hernia. You're down there." And I said, "Have you talked to your primary care doc?" "No, I can't talk to them about this."
Yeah.
I was like, "Why not?" He goes, "Because you're looking at it, doc." And I started laughing. I'm like, "Okay, I kind of get where this is coming from."
Right.
And I started realizing there's more to this.
Yeah.
And then with the whole pandemic and everything was happening then, and watching the basic premise of what's happening in the U.S. with health,
Yeah.
the way our diet has changed, the way our health has worsened, all of this fed into this desire to learn more. And I just basically was drinking from the fire hose for the last 5 years in literature.
Wow.
And I realized it's time.
Yeah.
It's time for me to do something about this.
So going back to the pandemic, you had mentioned that 70% of the deaths from coronavirus were men.
We're men.
So why do you think that is?
Well, there was a couple of papers that came out that the one commonality. So I'll give you an example. You walk through an ICU, and what you see is you figure, okay, I'm going to see 60, 70, 80-year-old guys on the ventilators because they're older, may have heart issues, maybe diabetic, maybe morbidly obese, and that's why they're on the vents. They get the virus. It's just enough to push them over the edge where they can't deal with it, and now here they are. But then you walk to the next room, and you see a 35-year-old guy, perfect health. Now, why is he on a ventilator next to this guy who's 70?
Yeah.
And it left a lot of the infectious disease doctors scratching their heads and frustrated.
Yeah.
Because why? Why is this happening? And no one had any answers. So a paper came out not too long ago where they mentioned that the commonality was low testosterone levels in these men.
Really?
And I heard that, I'm like, whoa. I said,
Yeah.
So it's very hard to bring out a causality in that.
Yeah.
But yet, still, 70% of deaths are men.
Yeah.
There's something to that.
Right.
So somehow the women were protected.
Yeah, it's not like women eat better than men, right?
No, we have the same diet.
Right.
But, it makes you think, is there a hormonal protective effect that the women have that the men don't? Have the women addressed their hormone issues, and that's why they weren't getting as sick? And the men just say, oh, I'm aging, I'll tough it out. I'm sleeping more because I'm getting older.
Right.
My muscle mass is down because I'm older. It's like a badge of honor to some guys, and guys are just gut it out. And they're also, guys are lone wolves. They don't tend to talk to each other about their health. Women get together, they talk about their health.
Yeah.
You never see a bunch of guys sitting around talking about erectile dysfunction. It's not going to happen. So this is
you watch Monday Night Football, you'll see enough commercials for it. But,
exactly. But it's not talked about. But yet, if a woman has a problem, they all know.
Yeah.
And they all talk about it. And they get help. And that's the difference. And I think some of it came from that as well. But I think that there's something about the testosterone levels to be looked at.
So now, as a business owner, you are going after a population that is hesitant to hire you, to come see you.
Yeah.
Right? Like the previous guest I had on my show got into roofing because there's an incredible amount of opportunity because there's so many homes in New Jersey that need to be, either the roofs or the doors or the windows. Whereas you consciously are going in, starting your own practice, going after a target market
the toughest
of people
demographic
that are hesitant to call you, right?
Yes.
But I applaud you for it. So my question then is, so what are you doing to get the word out and to let people know that, this is obviously one of the reasons this will help.
Yes.
To know who you are, how you can help them. In marketing, it's always about solving. My son is taking this financial literacy class at 12 years old. It's great.
Yes.
And they have to create a product and sell it. And he and his friend decided to do paper origami. And I said, Aiden, like the number one question you have to ask is there a need for this?
Yes.
And sometimes people don't need like toys, right? It's a want.
Right.
But the point is that how do you, from your point of view, it's like getting the word out there that, that you can help people because men are suffering from this and you can help them. And this is how you can make them feel. So what are you doing as a business owner to build that
it's
awareness?
Education. It's really education. I'm lucky enough that my wife has a huge practice, as you know.
Yeah.
And I would have to say most of her patients are menopausal women
who
are coming in for hormone replacement therapy. And most of what's happening is they're not getting treated because people were afraid of the hormones. Well, my wife's been keeping up on the literature. She knows the benefits. She knows the safety profile. So the women come in and they're blown away that they can feel better. And what we're finding is the women are going home feeling fantastic and seeing their husband losing his energy. Something's different. The women pick it up and they say, listen, I feel great. Do something about this. And that's driving a lot of the guys in.
Yeah.
It's the women feeling great, getting the hormone replacement therapy, and realizing that there's something for the guys too.
Yeah.
And it's funny how it's coming from that direction.
Yeah.
Most of my patients, their wives are sending them in.
Huh.
And I did not expect that.
Wow.
And then I have a group of guys who they come in and they see me and they go, wow. And they go tell their friends, listen, here's how I felt before. Here's how I feel now.
Yeah.
This is for real. And it's not just for aesthetics. This is going to make me live longer and feel good doing it. You know, so that's been driving things. So it's a combination of, first of all, starting out and not knowing where this was going to go.
Yeah.
To be honest. But the first couple of guys that came in, the feedback was so overwhelmingly positive. They would walk out and say, boy, you know, you asked me questions no one else has ever asked me. And I feel like we're going in the right direction. I'm excited about this.
Wow.
And everyone who walked out said the same thing to me.
Right.
And I realized, man, there's something here. And plus, I'm going through it too. I'm a man in my 50s. I felt it. It's for real. Brain fog is not a construct. You know, it's a real thing. And when you get on medication and you get your numbers right, boy, you feel like you're in your 30s again. Yeah. And it's like I'm back in the gym going, wow, I feel good again. I'm not going to the gym and every joint hurts and walking out pissed off because it didn't feel like it used to feel. Yeah. You know, so that's a positive reinforcement that brings guys back. Yeah. But like we mentioned before, it's that long-term goal of legacy, being there for your grandkids. Yeah. That's what drives the guys. And I think not knowing that there's something to help them do that is what's holding things back. So me doing this we're doing now is getting the word out, and hopefully people realize, boy, there's something here.
So are you able to walk me through the process? I know every patient is going to be different, but what is it like? Is it you come in once a week? You come in once a month? Yeah. Is it an injection? Is it a pill? How does it work if I'm a patient of yours?
Yeah, sure. So the Codex system that I came up with is my approach to men's health. It's looking at men's health and realizing that testosterone is the foundation of the building. If testosterone is not at the right levels, the building's going to crumble. I don't care what you do, medications for cholesterol, medications for you name it. Testosterone's got to be right. And what we see in guys, and this is kind of what drives this, is say, for example, and in my case, I'll give a personal case. Hemoglobin A1C when I was in my 40s, 4.2. In my 50s with no change in diet, no change in exercise, 5.7. Now, what's the difference? Testosterone level. So once you replace that, those things fix. You equalize. So rather than going to medications for your high blood sugar, fix with testosterone, then go back and say, okay, is it still high? Let's see if there's other things we can fix. So my approach when a man comes in is, first of all, detailed history and physical. You know, tell me about your surgery past, tell me about your medical past, tell me about your family history. Is there cancer in the family? Everything. And then a full exam. And then we sit down and say, okay, what's your diet? Give me a snapshot of the week. What are you eating? I need to know exactly. And what kind of calories? And they're always surprised about how much sugar they're eating. and that's the problem in the U.S. And I say, listen, you go to the supermarket, look at every ingredient. You know, it's time to pay attention to these things. This is a big deal. You can, in your 20s, you can get away with it. Right. You know, probably because your testosterone's so high, and it can deal with it. As you get older, you don't have that margin of error anymore. So after we look at that, then it's a matter of detailed testing. So hormonal testing, I do broad cardiac testing for all the guys. I do detailed cholesterol testing for the guys, more than what you get from your primary care doc. Right. And then when those results come back, we get a plan, and we go from there. So if your testosterone is low, and say, for example, you're a man in your 40s and 50s, you're done having a family, then you're a candidate for testosterone. We look at all the medical, there's some contraindications to testosterone. The biggest one is prostate cancer. So if you have prostate cancer and it's, say for example, it's operative prostate cancer, prostate comes out, clean margins, no residuals, normal PSA, you can get testosterone. That's okay. Right. If the cancer is still there, you don't want to supply more testosterone to feed the tumor. Right. That's a bad idea. So that's one of the few things that keeps people away. Cardiovascular issues are not a contraindication, amazingly enough, which surprised me, but some studies have borne that out. But the big thing is that. So it's a process. The dosing is prescribed. I don't do it in my office. I don't see any benefit in overcharging for hormones that I can get to then give to a patient. Okay. Go to your pharmacy. Use your plan. Yeah. You know, it's cheap. It's maybe $40 a month for testosterone.
Oh, wow.
And it's even cheaper for the injections. So I'm not a big fan of the injections.
Okay.
There's a gel available. And the gel you rub on your shoulders every morning. You get a shower, you brush your teeth, you rub it on your shoulder. It absorbs the same rate as the injections do, and you get the same results.
Wow.
Some men don't like it. I have gentlemen who, for example, I have some policemen that come in, they do jujitsu at night.
Right.
The problem with the gel is it can transfer to other people.
Yeah.
So if you're wrestling, you worry about the transfer. Some of the guys are like, no, I'm fine with the injection. I don't want to change what I'm doing. Great. We can adjust it and make sure it fits your lifestyle. There were some implantable pellets they were using for a while.
Okay.
Basically, a surgical procedure, you implant the pellets in the buttock. I'm not a fan of it because once they're in, it's a fixed dose. And if the dose is too high, the only way to fix the dose is surgically remove the pellets. Not a fan.
Yeah.
You know, it makes money for the doctors.
Yeah.
I think it's an inconvenience for the patient, not the best way to do it.
Okay.
There's a nasal spray available, also not the best way to do it.
Wow.
And there is an oral version of testosterone that has been used in Europe for quite some time that is safe, does not cause any issues, but extremely expensive. Yeah, absorption is okay. The problem with oral testosterone is you can't give an oral that's absorbed in the stomach.
Oh, okay.
It has to be absorbed lymphatically, because what happens is if it goes to the liver, you have increased rates of liver cancer and things like that, which you don't want.
Okay.
So this invention came in Europe first, but it's still under patent. It's extremely expensive per month, over $1,000 a month.
Oh, wow.
So I don't see any point in that unless until it comes down. There's a generic available that's comparable.
Yeah.
Then fantastic, it will work great.
Yeah.
But that's the issue with that. But there's a couple different ways to give testosterone, but that's kind of what's available right now for guys.
And does your body ever learn to make more, or do you always have to have the therapy?
If you are no longer making it,
Right.
you're done.
Right. Okay.
Yeah. So it's basically the testes make the lion's share of your testosterone, and over time production just comes down. So once it's gone, the production is low. So replacing it, it's not so much am I on this for life? Well, you're on it because your body's never going to make it again anyway. So we're just giving you what's not being made appropriately and now getting your levels to a point where it's therapeutic and you feel good again.
So the levels are like 200 to 700, whatever that 700
It's a
means.
huge range.
Miller, what does the 700 stand for?
Yeah. So basically, what we look at it's a range, and it's different from country to country, from medical group to medical group. Like it's anywhere from 300 to 1,200 is the range. So for a lab test, that's a ridiculous range. I mean, you're going to say, oh, my sodium's 300 to 1,200. No, I'm sorry, you're dead if it's 10 or 15 either way.
Okay.
It's a ridiculously huge range. So my feeling is I like to get the guys somewhere in the range how they were in their 30s.
Yeah.
I think 20s is not responsible because let's face it, you're still growing in your 20s.
Yeah.
I'd rather have you at a point where, okay, you're a full-grown man. Let's get you to the level where you felt good.
Yeah.
And that's where we want to be. We're not here to cause this crazy muscle growth. We want you functional. We want you healthy. That's the whole idea.
Right.
Yeah. So that's kind of, but the range is rather ridiculously huge. Estrogen is the same way.
Oh yeah.
So when women are being treated for menopause, once again, they look at the dose and look at your symptoms. Okay, have your night sweats gone away? Do you feel good again? Is your joint pain gone? Yeah. And say, okay, that's the dose for you.
You mentioned menopause, right? So is there a term called menopause, or
it's thrown around.
Yeah, there you go. I'm looking at your website here.
But the technical name for it is andropause.
Oh, okay.
Yeah, I like the menopause personally.
Yeah,
but I don't want to steal any thunder from the women, because I think they have a rougher time than we do. I think we have it easy in the grand scheme of things.
Yeah, I mean, you look at some of these women that their voices sound like mine, and
it's a hell of a time.
Yeah.
And plus the weight gain is real in both men and women. Yeah. And being back on hormones, you lose the weight.
Yeah.
Which is kind of interesting.
Wow.
So is it a miracle drug? No, but it's the foundation for your health. You can't just say I'm on testosterone now. I'm not going to do anything else. That's not going to work for you.
Right.
But if you're willing to work out a couple of days a week, if you're willing to watch your diet, you're going to feel fantastic.
Yeah,
and it's a big difference.
It's a part of a lifestyle.
It is
choice.
Oh, without a doubt.
Yeah,
without a doubt.
That's great.
Yeah, it's
so how do people? So you're in Paramus. So why don't you tell us where you're located and how people reach
so
you?
we're in Paramus Road, 275 Paramus, Forest Avenue in Paramus, in the TD Bank building. So the TD Bank, everyone knows where that is, roughly on the corner there.
Right.
And you call the office, you make an appointment, you come in. It's about an hour visit. Okay. I take time. So when you come in, you're getting the full up and down. But then we actually have LabCorp in our building, actually in our office. So
really?
I say, okay, you need these labs. Go to the next door and you're done, and that's it. So it's very convenient for the guys too.
Yeah, it's great.
So basically, it's about an hour visit for the initial.
Okay.
And then labs take about 3 to 4 weeks to come back. And then I do a telehealth, which is nice and convenient. So you can basically be from home on your computer.
Right.
We see what the labs are, decide how we're going to proceed next, and then go from there. So if you do initiate testosterone therapy, 3 months following therapy, we repeat the labs again, see where you are.
Right.
And the important things are a PSA, to make sure there's no changes with that, and also watch your hemoglobin too.
Okay.
Some ways of giving testosterone can bump both of those numbers. I find the gel does not do that, which is why I like it too.
Okay.
But that's basically how it works. And that's basically, it's, initial visit, 3 months, sometimes 6 months, and then a full year from the initial visit.
Okay.
We go. And so it takes, I would think, about a year and a half to get your numbers where they need to be.
Right.
It's, every guy's different, and everybody metabolizes testosterone differently.
Sure.
Everyone absorbs it through their skin differently. So it's a case by case. I don't look at it's not a factory. You don't walk in the door, get your testosterone shot, and walk out.
Right.
It's not like that. We have to. Everybody's different. You have to treat each patient individually, and that's where the importance is. Yeah.
That's great.
Yeah.
Well, thanks so much for being on the show. I really
it's fun.
I learned a lot, and I'm sure a lot of people will learn more. And
I mean, education is everything with this, and having the opportunity to talk about it is huge.
Yeah, that's
it's
great.
Huge. Yeah.
Well, thanks everyone once again for joining us at the Good Neighbor Podcast, and we'll be right back. Thank you.